basically, we want to extend the occiput, side bend, rotate to the same side. Okay, making sure that we maintain the extension. Okay. What happens is people extend, and then they side bend, and then they rotate, and now I'm back in neutral. So I'm not really testing the vertebral artery. So you want to make sure your fingers are down on the spine so that you're getting that suboccipital extension and keeping it. Okay. And then she counts back from 30. Out loud.
30, 29, 28, 27, 26, 25.
And the full test is 30 seconds. Okay. Once you get to about 15 seconds or so, there's going to be a problem. It should be starting. So if you have any notions whatsoever, you go to the full 30. If the person is fine, they're young, blah, 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 in 15 seconds they're perfectly fine, then you can bring them out of the test position. Why? I don't like to deliberately cut off someone's circulation. I just don't. So if you don't have to do the whole thing, don't do it. Okay, yes.
Do they feel any pain?
If they have restrictions, they might feel some discomfort. Some people you can't even do this test to because they just have no mobility in their spine. If that's the case, I usually try and do an active test, and I'll show you that in a second. And actually, most people I try and do an active test first, because this way they're moving themselves, and I'm not forcing them into a position.
Make sure you have them keep their eyes open.
Yes.
Because you're kind of also looking for any kind of funny eye movements.
Yeah.
And also, if they tell you, I just don't feel good,
Right.
that can be a positive test.
Mhm.
You shouldn't feel nauseous or strained or say, I really don't like that.
Yeah. Go with the little hairs on the back of your head on this one. So again, then I would extend.
Be careful with each other because there may be those of you in here that don't
So
like it
extend,
either. So
side
you're
bend,
young, doesn't work.
rotate, and then I have her count again. And what are my signs?
Dizziness, blurry eyes.
Dizziness, double vision, nausea, feeling like you're going to pass out, slurred speech, all things of brain, all things brain, okay? So that's the vertebral artery test, okay? Basically, I'm cutting off the circulation of one and opening up the other, okay? I'm cutting off circulation on the same side I'm turning to and opening up the opposite side. Now, if I have someone that has a very forward head, and basically they're in the position, and I can't really extend them or it's very painful, what I do is an active test. So I'll have the person sit up over the edge. And so I'll have them, of course I prefer their feet on the ground, because if they pass out on me, I have no control here, okay? But being that we're on this table. So what I have them do is they hold their arms out, and then I have them extend, side bend, and turn. And it's an active test, so they're actively doing it. And then they're counting, and I'm asking them, and I'm watching their eyes. If I start to see movement in the hands, one hand starting to sink, their speech gets funny, they start to feel funny, get them out of the position, okay? And then that's a positive test. I kind of put the hands up because it's harder to hold that position. So if they're going to have a problem, they immediately start to come out of that position. It's more difficult to hold.
If they can't do active, you won't go into manual?
No, what I'll do is if they have a lot of cervical, very forward head, I'll have them do it actively. I won't manually do that because I could hurt them by pushing them into a position. So I had them do it to themselves. Tell you the truth, if I have someone that's that impaired, I don't think traction's a good choice. And that's the truth. I think you're better off doing massage and manual stuff and stretching first.
Is this problem usually
well, as far as vertebral artery issues because of degenerative changes, older. As far as vertebral artery issues for genetic issues, any age, obviously. Typically, yes, older patients, but don't be surprised.
Okay.
Now, that's really all I have to say about that. So that's a vertebral artery test. Extend, side bend to the same side, rotate to the same side. Pinching off this side and testing the patency of this side. If everything is copacetic, they shouldn't lose any brain function because there's circulation going through. If there's a problem, you'll see brain dysfunction.
You're occluding the ipsilateral side?
You're occluding the ipsilateral side and testing the patency, openness of the opposite sides. Okay. Now, transverse ligament testing. Transverse ligament test is that ligament that lies in front of the dens and holds the head over the spine, basically. C1 and occiput over the spine, right? So to test that, I have to put my lumbrical grip at C2 transverse processes, my hand on the forehead, and I'm creating a force. I'm pushing the head backwards. If I get a clunk, it's positive. The best way to do this test is to make sure they're in a good position. So if they're slumped, you're not going to do a good test. You're just going to basically push their head backwards, and you're going to get extension, probably. So the first protuberance that you feel when you come from the occiput, greater occipital protuberance, you pop down, there's a space. The first thing that you feel is C2, spinous process. So then you put your fingers on either side of it. One hand here. What happened to me? I think I shrunk. Give me that step.
This one?
Yeah. I think I used to be able to do that. See what's happening to my desk?
It's got a long back.
So just make sure she's up. Again. Pop it down. If you're having trouble feeling it, nod the head. And you'll feel it pop up your finger. So it's right about there. This hand goes here, and bring the head down just a hair. Okay. So that the force is this way. And I hold here and I push back. Yeah, arms out because I'm creating the harder. Yeah, I'm pushing pretty darn hard. And I can feel it move, and I can feel it release. She's pretty tight. Good thing. Good for you. No plunking, but it's not necessarily comfortable.
And it's anterior posterior force, right? Not anterior.
You don't want to. I kind of do more holding here, more pushing here, because I have a bigger surface here, and that just gets really uncomfortable. Yeah. Okay. But that's a transverse ligament test. If you do it right, you will feel a little movement. That's normal. Everybody has a little movement. It's when it kind of clumps or you got a lot of movement, there's no end point, that you get concerned. Don't just let go and say, oh gosh. Okay, you got to slowly release it, even in normals, because it will actually feel like your head is kind of popping into place. It's not a fun feeling. Okay, so you want to release very slowly also. Did you feel it? Most of the time, once we start practicing on each other, you start, oh yeah, I felt that. And then you kind of feel it, just like you feel a Latin test. So that's Sharp-Purser's test or transverse ligament test. There is another way to do it. If you lie down. And that is to kind of palpate to C2, and you put your fingers really on C1. And what you're trying to do is just sort of lift up. And see if kind of everything comes with it. That's a much harder test to feel and do, and so I prefer to do the other one. Because you really, it's hard to interpret. All right, so vertebral artery, extend, side bend, rotate to one side, and you're looking for dizziness, nausea, double vision, slurred speech, brain issues. Okay. For transverse ligament, sitting up in a good posture. Actually, make it easier in the chair. Bring the head down just a little so that your force is kind of almost going like that in the plank plane that the joints sit in. And you're just holding, pinching at C2, and pressing back anterior to posterior with the palm on the forehead. If you don't have them in the right position, what you'll get is this. Okay, you'll actually extend them. So if you're doing this and the person is just extending, you don't have them flexed enough into the right plane. All right, so let's get a partner and we'll work on it.